Dr. Harvey Elder, professor in the School of Medicine and the School of Public Health here at Loma University, runs an ongoing seminar that helps teach students and staff how to more effectively communicate with their patients.
We recently held a conference on Ministry of Healing, From Desire to Competency. And its goal was to teach those who would like to know how to help patients with their spiritual life, how to do that in a very simple way. So the program was designed so that clinicians, people who take care of patients, could ask just a few questions and come up with some assessment of where a patient is spiritually, and then simply ask, is this a problem? Would you like help with it? And if the answer to that was yes, they would like help, then they would call the chaplain to help them with it. First time a person does this, we're really taking them outside their circle of comfort. This is, I think, by and large, scary. My guess is their adrenaline level is up. They have decided they're going to do it because they believe God wants them to do it. They have in their heart a desire. This is why I went into the clinical arts, was to know how to help people, not just physically, but also spiritually. And so there is the big desire to do it, but there's also fear. Patients the responses are, I would say 90–95% incredibly positive. You know, lying in bed is pretty boring. Television is pretty insipid. And here is a living human being who wants to hear what they have to say. And there's something very attractive about a person who wants to listen to you. Very often we'll tell them, we know a lot about the disease, but what has it been like to be a patient with the disease? We need you to teach us. And they're happy because they are teaching their clinician, which means they are developing a memorial of themselves. And they are being remembered for this because, in fact, they really are teaching clinicians how to give better care. As people take part and they realize the patient is happy to see them. The patient doesn't feel invaded. The patient doesn't feel we're messing with something we shouldn't. I mean, we are not prying into something they see as private. They're happy to talk about it. They pick up courage, and as they talk to another patient and see the same thing, they begin to realize, I can do this. This is useful. And they begin often to think about, well, I have so-and-so as a patient. This would be helpful with them. And I've had several people tell me, in the next week, there were several patients I used this on, and it was very helpful. It made a huge difference. What we as clinicians do is always based on the patient's need, not whether we like doing it. And so as medical students, we go way outside our circle of comfort to learn. And again, we're talking about outside the circle of comfort to learn, so we can do and meet patients' needs.